Okay, so we've had some really interesting sources sent in by you looking at, well, the persistent challenge of managing chronic pain.
Mm,
And what really jumped out from this Australian research is this idea, maybe even a game changer, that getting a better handle on our emotions could actually help relieve physical pain.
that's exactly it.
Mm.
Researchers from UNSW Sydney and NeuRA, that's Neuroscience Research Australia, they've published some, well, pretty compelling findings.
In JAMA Network Open, I saw.
That's the one. And their work really points towards this strong link between how our brains process emotions and, how intensely we feel chronic pain.
Right.
So the idea is if we can improve that emotional processing, we might actually see a real reduction in the pain itself.
Okay, let's dive into that a bit more because honestly, it sounds a little surprising at first glance.
It does, yeah.
That our emotional state could have such a direct measurable impact on physical pain. What exactly did they find?
So the core discovery, really, is that if you can enhance how the brain deals with emotions, people can experience a noticeable drop in their chronic pain level.
A noticeable drop.
Yeah. Professor Sylvia Gustin, who's leading a lot of this, put it quite well. She said, by changing how we manage emotions, it is possible to change the experience of pain itself.
Wow, okay.
And what's really key here is the potential for long-term improvement. It's not just about masking symptoms temporarily.
So it's like maybe chronic pain keeps the nervous system kind of stuck on high alert, and this helps dial it back.
That's a good way to think about it, yeah. It's about retraining those responses.
So how did they actually, test this? What kind of intervention did they use?
They developed something new, a digital health treatment they call pain and emotion therapy.
Okay.
And its whole goal is to help the brain learn different ways to handle emotions, basically, dialing down those really strong negative reactions.
Which I guess are common with chronic pain.
Very common, yeah. And at the same time, strengthening more positive emotional responses.
And they actually ran a trial with this, with real people.
He did, yeah. It's a proper clinical trial. It ran from about March 2023 to September 2024.
Okay.
At Naradi's Center for Pain Impasse-T, they had 89 people, all living with chronic pain, taking part.
And how was it delivered? You said digital.
Exactly. It was all online. 8 group sessions, therapist guided, using video conferencing so people could join from anywhere in Australia, really.
That's great for accessibility.
It is. And they also got an app and a handbook to support their own learning between sessions. Plus, crucially, there was a control group.
Right, essential for comparison, people who just carried on with their usual treatment.
Precisely. Standard care.
So the big question, what happened? Did the pain and emotion therapy group see different results?
They certainly did. The results were quite significant. Participants who got the new therapy reported, firstly, that they were better at managing their emotions.
Okay, that makes sense. That was the target.
Right. But they also experienced a pain reduction. And it averaged out to about a 10-point decrease on a standard 100-point pain scale.
10 points?
Yeah, and that was measured over a 6-month follow-up period.
So a 10-point drop.
Mhm.
That feels like something you'd actually notice in your day-to-day life. Did Professor Gustin comment on that?
She did. She stressed that it wasn't just, statistically significant noise. It was a clinically meaningful improvement.
Oh, right.
Something that genuinely makes a noticeable difference to people's lives, which is huge when you think about how many people are affected by chronic pain.
Yeah, it's not a rare condition, is it?
Not at all. We're talking chronic pain lasting more than 3 months, affecting something like 30% of people globally.
30%. Wow.
And the ripple effects are enormous. The economic cost, for instance, is just staggering. It actually exceeds the costs of heart disease, cancer, and diabetes combined.
That puts it into perspective.
Right.
Which is incredible. And the mental health link is strong, too, isn't it?
Very strong. Estimates suggest up to 80% of people with chronic pain also experience depression and anxiety.
80%.
And tragically, suicide rates are 2 to 3 times higher in this group, compared to the general population.
That's awful. It really highlights how intertwined physical and emotional suffering can be.
Absolutely. It makes you wonder why treatment hasn't always focused more on both aspects together.
So this link, this interplay, Professor Gustin talked about the mechanism behind it. Why does pain affect emotions like this?
Yeah, she explained that a really key factor in the progression or the worsening of the condition is this inability to regulate negative emotions.
Okay.
Basically, she says chronic pain can actually disrupt the brain's emotional circuitry. It messes with the pathways we use to manage feelings.
So the pain itself changes how your brain handles emotion.
That's the idea,
Yeah.
leading to what they call emotion dysregulation. And she made a crucial point. This aspect is often ill understood and undertreated.
Right. It's like a hidden part of the problem.
Exactly. Maybe the constant pain signals create this kind of negative feedback loop in the brain's emotion centers.
Fascinating. And you mentioned we heard from a participant, someone who went through the trial.
Yes, Jabez Allies. She's lived with chronic back pain for 10 years.
Okay.
And she described it really clearly. She said, "It makes me feel more worried, moody, and frustrated, which in turn affects my pain."
Ah, the cycle.
Precisely. She went on, "The more negative emotions I have, the worse my pain is, and vice versa. It's that classic vicious circle."
You can really picture that. Pain flares up, you feel down or anxious, which then seems to make the pain even worse.
And Professor Gustin confirmed, yeah, that's a very common experience. It just underlines why we need approaches that tackle both sides.
It really does, and it sounds like the whole approach to chronic pain has been shifting over time anyway.
Definitely. Dr. Nell Norman Nott, another researcher on the team, talked about this evolution. Over the last, say, 50 or 60 years, we've moved away from seeing pain as just a biological thing.
Right, not just tissue damage or something.
Exactly. Now it's much more of a holistic view, the biopsychosocial model, they call it, recognizing that psychological and social factors play huge roles too.
Okay.
But even with that shift, while pain meds obviously still have a role,
Sure.
they have limits. Side effects, they can become less effective. And then there's the whole issue with opioid dependency, which is, a massive concern.
Absolutely.
And while psychological therapies exist and generally have fewer side effects, Dr. Norman Nott felt there was still room for improvement, especially in directly helping people identify, express, and manage their emotional reactions to the pain.
So existing therapies were maybe missing something specific about the emotional regulation part?
That's exactly how she framed it. She literally called the focus on training emotional regulation the missing piece of the jigsaw puzzle of chronic pain treatment.
The missing piece.
And that's really what this pain and emotion therapy is designed to provide.
Yeah.
Directly targeting that emotional processing skill.
And it seems like it hit the mark for some participants. We heard from Richard Beaumont, too.
Yes, Richard's story was also quite powerful. He deals with both cancer-related pain and chronic lower back pain.
Tough combination.
Yeah, and he said his pain could often reach an 8 or 9 out of 10. Really severe.
Wow.
But after doing the pain and emotion therapy, he said, and this is a great phrase, "I can bring this right down to a 4 or 5 just by calming the farm."
Calming the farm. I like that. That's a significant shift.
Isn't it? Going from an 8 or 9 down to a 4 or 5 consistently.
Yeah.
That changes everything. It suggests people can gain a real sense of agency over their pain.
It really does. So how exactly does this brain training for emotions work to reduce physical pain? What's the connection?
Well, Professor Gustin pointed to earlier research showing that our brains are, adaptable. They can learn new skills, including how to manage difficult emotions better.
Neuroplasticity, that kind of thing.
Kind of, yeah. And this trial essentially confirmed that when people practice these emotion regulation skills, it doesn't just help them feel better emotionally. It actually leads to lower reported pain intensity. And improvements in other related things, too, like depression, anxiety, even sleep problems.
So it has these knock-on benefits.
It seems so. It suggests that changing our emotional response might actually change how the brain interprets or processes the pain signals themselves.
Interesting. And Dr. Norman Nott added a bit more detail on how the therapy helps.
Yes, she explained that part of it is helping people just acknowledge difficult emotions. When you're in pain constantly, it's easy to try and suppress negative feelings.
Yeah, to bottle them up.
Right. Or you might even find it hard to feel positive things anymore. So the therapy helps bring those suppressed feelings out, helps people accept them as normal, and process them constructively.
Okay.
And importantly, it also helps people reconnect with positive aspects of life, things they enjoy, setting goals again. It's not just about the negative.
That makes sense. Addressing the whole picture. And you mentioned accessibility earlier, the online format. That seems like a big deal for chronic pain treatment.
It really is. The researchers specifically mention the problems people face: long waiting lists for psychological support, services being concentrated in big cities.
Yeah, if you're rural or remote, it's much harder.
Exactly. So delivering this online meant people could participate from literally anywhere in Australia, from home, using the app and workbook whenever suited them. It breaks down huge barriers.
Definitely a positive step. So what's next for this pain and emotion therapy? Are they taking it further?
Yes, the plan is for a much larger clinical trial.
Yeah.
They've actually secured funding for it from the Medical Research Future Fund.
Oh, great.
And that's due to kick off in 2026. They're already encouraging people who might be interested in participating to register their interest now.
Good to know.
And Professor Gustin summed it up nicely, saying these results are a big improvement in our understanding of chronic pain, showing how important it is to treat both the body and emotions together.
It really feels like a significant shift in perspective. And just for anyone wanting the specifics, the study is Online Dialectical Behavioral Therapy for Emotion Dysregulation in People with Chronic Pain, a randomized clinical trial.
That's it. Nell Norman Knott was the lead author, published in JAMA Network Open, May 6th, 2025.
Got it. We'll make sure that's clear for listeners.
It's definitely an important paper.
So, wrapping this up then, the main takeaway really is this, well, surprisingly powerful connection between managing our emotions and finding real relief from chronic pain.
Absolutely. It offers a genuinely new angle for treatment, potentially improving life for so many people.
It really drives home how linked our minds and bodies are, doesn't it? That nurturing our emotional health could be a key strategy against physical suffering.
Couldn't agree more.
And, it makes you wonder, if emotions and physical sensations are this closely tied with pain, what other areas of our health and well-being might be influenced by how well we manage our emotional responses?
That's a really interesting thought.
Yeah, something maybe for you to ponder. How might getting better at navigating your emotions impact other parts of your health, maybe in ways we don't usually consider? Definitely food for thought.